coronavirus advisor and top U.S. infectious disease official, Dr. Anthony Fauci, said it is unlikely that a coronavirus vaccine will be ready by the U.S. election on November 3. But he believes we will know whether we have a safe and effective vaccine before the end of the year. Take a look.
Well, I think that's unlikely. I mean, the only way you can see that scenario come true is if that there are so many infections in the clinical trial sites that you get a efficacy answer sooner than you would have projected. Like I said, it's not impossible, Judy, but it's unlikely. End of the year, by November or December, we will know whether we have a safe and effective vaccine. I feel cautiously optimistic that we will, given the preliminary data that we've seen. And then there are a couple of other vaccines that are going to go into phase 3 trial at the end of September and then October. So sequentially, you have a lot of the candidates in play, which really is the reason why we're optimistic that we will be successful with one or more. We've got to get a higher percentage of minorities into the clinical trial so that when we get the data, we can say that it applies equally to the minority communities, African American, Latinx, Native Americans, and others, because we want to make sure that when we say that something is safe and effective, we mean it's safe and effective for everyone. That we need to do a little. The data as they come in go to an independent data and safety monitoring board who then make the recommendations as to whether or not the vaccine is effective or not, whether it's harmful or not. And then when that data is available, it would ultimately become public. The FDA has publicly promised that they would not allow political considerations to get involved in their decision.
Meanwhile, the CEOs of 9 companies developing vaccines against COVID-19 pledged to uphold the integrity of the scientific process, amid concern that President Trump will pressure regulators to approve a vaccine ahead of the presidential election in November. It said, we, the undersigned biopharmaceutical companies, want to make clear our ongoing commitment to developing and testing potential vaccines for COVID-19 in accordance with high ethical standards and sound scientific principles, according to the CEOs. The statement was signed by AstraZeneca, BioNTech, GlaxoSmithKline, Johnson & Johnson, Merck, Moderna, Novavax, Pfizer, and Sanofi.